Before we get started on the advanced therapies, we're going to do a quick review of what we already know. First of all, our goals of treating sleep-disordered breathing. Remember, predominantly we're looking to eliminate apneas, hypopneas, and snoring, any obstructive events, anything that blocks the airway. We also want to normalize oxygen saturation and ventilation and improve sleep quality. We need to individualize the treatment to the patient and include them in the decision making, because there is not one treatment that everybody is happy with. Remember the common features of sleep disordered breathing. They're most common in male, especially over 40 years old, but after 65 we do not see it appearing anymore. Upper body obesity with a neck circumference of 17 inches in men or greater than 16 inches in women, a history of snoring, fatigue, excessive daytime sleepiness, and hypertension. Quick review of the complications of OSA if it's not treated, and this pretty much goes for any sleep disordered breathing. Cardiopulmonary issues include nocturnal arrhythmias, that means their heart rhythm is abnormal, hypertension both at night and during the day, pulmonary hypertension, right or left ventricle failure, that's heart failure, myocardial infarction, that's a heart attack, and strokes. Neurobehavioral issues include excessive daytime sleepiness, a diminished quality of life, adverse personality changes, and motor vehicle accidents. Metabolic issues include insulin resistance or diabetes 2, which cannot be reversed even when it's treated, and altered lipid metabolism. So again, some other topics that we've already covered that I just want to touch base on again. CPAP is the #1 treatment for uncomplicated obstructive sleep apnea. AutoPAP has comparable results for those with uncomplicated OSA, meaning there's no comorbidities with it. If there are comorbidities associated with obstructive sleep apnea, they are not eligible for AutoPAP. They need to be on CPAP or another therapy. You need to find the appropriate interface device and correct fit for patient compliance. Pressure relief technology, ramping, humidity are all options to make CPAP more comfortable. You want to identify the adherence within the first few days and troubleshoot if needed with the patient. Bilevel PAP or VPAP are possible options for obstructive sleep apnea after all other options are exhausted. And surgical, dental, and other options exist, but careful patient selection is imperative for effectiveness. Just to review, CPAP intolerance is an indication for BiPAP therapy. However, before you can switch to BiPAP therapy, you need to make sure you have exhausted all other options. If the patient complains it's difficult to exhale against the pressure, you want to try some pressure relief technology. And if that doesn't work, then you might go to your bilevel therapies. If the patient complains that the pressure is just too much, have you tried ramping so the pressure slowly adjusts? Have you tried AutoPAP? You could also do an oral appliance with CPAP or position retaining with CPAP. That way they have a lower CPAP pressure. If all of those have been exhausted, then your bilevel therapy would be appropriate. Another situation is if the patient experiences gastric distension with CPAP. That means they're swallowing a lot of air. In that situation, bilevel therapies may also be indicated. Okay, so when we talked about our advanced therapies or alternative therapies, we're really talking about what's called non-invasive ventilation. Now, this is really a respiratory therapist's scope of practice. However, when it's treating sleep-disordered breathing, then we are able to work with non-invasive ventilation as sleep techs. Non-invasive ventilation are positive pressure devices which normalize ventilation. They do this by increasing tidal volumes and regulating respiratory rates. Respiratory therapists are the experts in managing these devices, so if you ever need assistance, they are the ones to turn to. And any inappropriate use of these non-invasive ventilated devices, they can be deadly. So you really want to make sure you're using the correct mode in the correct settings.